All right, welcome back to the Dr. Jin Sung show. Today is Tuesday, 12:30, and today we're going to talk about diarrhea, constipation, and all the fun things we talk about with bowel movements. Today's topic is IBS, or irritable bowel syndrome, and there are many millions of Americans who have IBS. So let's just kind of go over the symptoms of IBS, and I'll go into the mechanisms and some of the main causes for IBS symptoms. So if you look at the symptomatology for, let's say, irritable bowel syndrome, and let's make it clear, when you say irritable bowel syndrome, it's just a term to determine, to explain changes in bowel movement, okay? So if you have abdominal bloating, belching, or flatulence, abdominal pain, cramping, constipation, diarrhea, nausea, GERD or gastroesophageal reflux disease, or if you have fat in your stool, or basically your stool floats when you have a bowel movement, if you have nutritional deficiency or malnutrition, if you have fatigue or unexplained rashes or eczema or rosacea, you may have IBS type symptoms. It can also affect the brain and how the brain functions, so brain fog, mood disturbances, depression, anxiety can also occur. So when we say IBS, it's like saying fibromyalgia. It's just a term, right? But what is the real underlying cause for IBS? And a lot of people don't know this, and a lot of clinicians actually do not know this, unless they're in the GI field, is that if you have IBS, the number one cause is really SIBO, or small intestinal bowel overgrowth. And I've mentioned this in our prior videos, but we're going to go into SIBO in depth because it is the number one cause in my opinion. So all the symptoms that I just mentioned about the abdominal bloating and belching and constipation, and all those are signs of SIBO, small intestinal bowel overgrowth. Okay, so let's go into how do we test for SIBO, right? So you eat food and you get this bloating, you get this abdominal bloating, you go, oh boy, and women will say, I feel like I'm 4 or 5 months pregnant, I look 4 or 5 months pregnant. And how can we test if that patient has SIBO, or small intestinal bowel overgrowth? Okay, the number one standard really is a biopsy, a jejunal aspiration or aspirate, where they go in and take a sample of the small intestine. The only drawback to this test is because they can't take multiple samples throughout the entire small intestine. They can only get a couple samples in the upper small intestine. So there is some limitation to that, but it is considered the gold standard. The other one would be if I got an infection, a throat infection, let's say, and I started taking antibiotics for it, and all of a sudden my bloating subsides and my stomach feels so much better, right? That is another clinical sign that you may have small intestinal bowel overgrowth. The other standard test is a breath test, and it's most commonly used because it's non-invasive. Basically, you drink a solution made of lactulose or glucose, and we try to stimulate the gas production of the overgrowth of the SIBO, small intestinal bowel overgrowth. So before I go further, what is small intestinal bowel overgrowth, or SIBO? It's basically when bacteria that lives in your GI tract, along the entire GI tract, some is more predominant in the small intestine, and some are more predominant in the large intestine. And what happens is you have a migration of some of the bacteria in the large intestine up into the small intestines, where it should not be, right? So if you have bacteria that's not supposed to be at a certain location, what it can do is create excessive gas, okay? So SIBO is basically a migration of normal flora or normal bacteria in your body into the wrong place. It should not be in the small intestine, but it is, and it's overgrowing in that area. And that causes the production of excessive gas. So going back to the breath test, if you look at the breath test, like I said, there's two different forms where you can do lactulose or glucose, but essentially they're checking for methane gas and hydrogen gas. Okay, so if you have methane gas, the predominance is constipation. Like some patients will come in here and go, Dr. Sung, I haven't had a normal bowel movement in years. And I would go, well, how often do you go? And they say, well, sometimes it's once a week, sometimes it could be 10 days, or I have to take something, right? That patient may have a methane overgrowth, methane gas overgrowth, and it's causing constipation, right? They're not having the bowel motility to get the bowels out of your system. The other gas is hydrogen gas, and that's usually associated with diarrhea or loose stool. Okay? So these are general rules, like methane is constipation and hydrogen is diarrhea. However, there are always exceptions to the rule, because sometimes people can have both gases. You can have methane and hydrogen gases. And there are other gases that might not be detectable with the traditional test and still be considered SIBO, okay? So, when we look at SIBO, you have the testing, you have all these symptomatology, right? And then what do? The number one thing you can do is eliminate certain foods that create excessive gas. There's certain sugars that create excessive gas in our system, right? So basically we try to starve it out a little bit. And we don't want to do this too long because we want to be able to preserve our gut ecology, the biodiversity in our gut. But in the beginning, what we want to do is remove or starve out some of the bacteria so that your stomach will start to feel better, right? So certain diets like FODMAP, FODMAP, FODMAP diets, or specific carbohydrate diets, or a modification of a SIBO diet, or a elemental diet, which is like 2 weeks of just nutrients and liquids, which really starve out the overgrowth in your stomach. So there's a variety of different diets that can occur, that can be utilized to help patients who have SIBO or IBS, right? It's just a matter of determining what would fit right for a patient who has SIBO and what kind of diet would work best for them. For example, if someone has significant blood sugar problems, like I miss a meal, I feel shaky, I feel agitated, I feel angry, that is not the person we want to put on an elemental diet, because their sugar processing is off and they will feel horrible on a diet like that. Okay? So each diet is different and it has to be customized for the patient, and not everyone has to be on a strict FODMAP diet or a specific carbohydrate diet, or they may have to be on that, or even an elemental diet in very severe cases. So dietary restriction is very important in terms of starving out the overgrowth in your GI tract. The next step is to kill it. So what we do is you have to be able to take some antimicrobials or antibiotics to kill off some of the overgrowth in the small intestine. So the traditional medications that are used in medicine, essentially, is 2 antibiotics or a combo of them. One is called rifaximin, and the other is called neomycin. And these antibiotics tend not to be absorbed in the GI tract. It's basically trying to localize it within the GI tract. So it's not like a broad spectrum antibiotic that kind of gets into your system and kills everything off. It's more localized. However, it does have some systemic effects, obviously. So the 2 antibiotics is rifaximin and neomycin. And usually if you use it in conjunction or together, you have a better outcome. Now, if you use antibiotics along with, let's say, some natural herbal remedies, your outcome can be even better, right? So I have patients come in and go, you know, I've done 2 rounds of rifaximin and I felt better with the treatment, but it came back. And in the second round, it wasn't as effective and it came back, right? And here they are in the office. So sometimes what we do in this office is we might put them, with the help of their primary care physician, put them back on rifaximin, but we will add in herbals, berberine, which is really good, alicidin, which is a garlic extract, oil of oregano is really good, neem oil is also very good. So you have these natural antimicrobials that you can use to knock down the overgrowth of SIBO, okay? In conjunction with that, you want to be able to move the bowel, especially if we have constipation. You want to be able to move the bowels to get it out of your system quickly. And the other way to do that is using a prokinetic, or something that just helps the motility of your GI tract. And ginger and cinnamon tends to be pretty good at that. So you can use ginger as a prokinetic, basically something that will help eliminate your bowels at a faster rate, so you don't have this overgrowth of gas in your system. Okay. So those are the basic fundamentals of SIBO and treatment of SIBO. What a lot of practitioners don't know or talk about is the migrating motor complex. What that means is that we have peristalsis of the intestinal lining, right? So if you eat, it has to squeeze and digest and so forth, and suck up the nutrients and then suck up the water, and then you can have a bowel movement. Okay. What we also have is a brain-based issue sometimes, meaning your brain needs to have your bowels contract. And this is where certain neurological exercises can be beneficial for someone who's got abnormal bowel movements. So Dr. Karazian and some of the people in the functional medicine world use vagal stimulation, right? A vagus nerve is basically a nerve that goes from your brain down into the GI tract and kind of innervates the GI tract. So if this vagus nerve is not firing or not working at its optimal, we may develop bowel issues. So a good way to stimulate the vagal nervous system is by humming, gargling, gagging, or even singing out loud. So humming, I'm not just talking about just a little hum, I'm talking humming out loud, singing out loud, right? Gargling in the shower. You want it to the point where you're gargling and water is sprouting out of your mouth, gargling in the shower, right? And you can also gag by when you brush your teeth, you take your toothbrush, go to the back of the throat, to the tongue, and when you get that gag reflex, right, then you are really stimulating the vagal nervous system. So the migrating motor complex is very important for bowel movement, and the stimulation of the vagal system is crucial in order to restore normal bowel function, along with all the natural remedies and diets and sometimes in certain cases you'll need antibiotics and so forth. So that is a basic nuts and bolts. I mean, really we can spend a 40-minute lecture on just the migrating motor complex. We can spend 50 minutes or an hour just talking about specific sugars and so forth. We can spend time on just herbals. But the real gist of it is, it's the idea of IBS is just not, I have stomach issues. There's some underlying causes that can be helped, okay? So we're looking at antibiotics, we're talking about natural herbal remedies, a prokinetic, which is, you can use ginger, migrating motor complex, which is basically stimulating peristalsis, and the vagal nervous system can assist in that. And then another thing is the ileocecal valve, the valve that connects the small intestine, right, and the large intestine. There's a little valve there, and that should open and close, and not be open in the open position. Then bacteria from the large intestine will sneak back into the small intestine. So ileocecal valve manipulation or a visceral manipulation can be very helpful in that. In our office, we actually use certain stimulation to stimulate the vagal nervous system. We also do laser application on the abdomen to really knock down the bloating. We can also use something called PEMF, or pulse electromagnetic frequencies, that can really attack that overgrowth and get your cellular function normalized. Okay. If you have any questions, please post on the video below, and I'll try to get to that this week. I'd like to thank all the people who have been subscribing and liking our page, and hopefully you're getting the updates on our videos, and hoping that you get some benefit out of this. So please like the page, share it with your friends and family. We want to provide quality information for everyone, and we'll see you next week, Tuesday, 12:30, okay? So you have an awesome day, and we'll see you next week. Bye-bye.